The World Health Organization and the Public Health Agency of Canada, along with Manitoba Health, Seniors and Active Living, are actively monitoring the situation in Wuhan, China with the novel coronavirus. While the risk to Manitobans is low, healthcare providers are being asked to be aware of clients with relevant travel histories and symptoms that could raise the possibility of infection with the novel coronavirus. These symptoms and travel history include fever and acute respiratory illness with or without pneumonia, and travel to Wuhan, central Hubei, China within the last 14 days. As well, or close contact with an ill person associated with that outbreak in Wuhan, China. As of January 17th, suspected cases of novel coronavirus are required to be reported to the Chief Provincial Public Health Officer. Currently, health providers have been provided with information regarding these symptoms and travel history, as well as infection prevention and control measures should a case be suspected, as well as the requirement to consult an infectious disease specialist and report the concern to public health. For more details on the coronavirus or travel advisories, you can always check the Government of Canada resources online. So thanks, and I can open up to questions.
Has there been any suspected cases here or things that you guys have been curious about which have popped up already?
In Manitoba, we haven't had any persons under investigations as of yet. There haven't been any confirmed cases in Canada. There's been some testing that's gone on in other jurisdictions and people being assessed, but no confirmed cases in Canada as of yet.
What kind of protocols would be put in place if this were to come to Winnipeg or any confirmed cases in Canada?
Yeah, well, we already have a province-wide preparedness plan for this. So all healthcare providers now are aware of the requirement to question regarding this travel history. Should a suspected case be identified, we have right now a process to implement the infection prevention and control guidelines to limit the possibility of spread, as well as testing protocols in place.
Give us any ideas what those guidelines include?
These ones, anyone who is identified meeting those criteria, fever, acute respiratory illness, and that 14-day recent travel to Wuhan, China, would be not cohorted with other clients and would be put under what we would call contact and droplet precautions.
What does that mean?
This would be anyone caring for those individuals would be wearing a eye shield and a mask. And the person would be in a room by themselves.
How soon would that happen after triage?
This would be at triage. Anyone identified would be immediately put in a room by themselves.
What about if this were to happen because it's flu season and the ICUs are already at capacity? So what sort of protocol would happen there if there needed to be a quarantine in an ICU that's already full?
Right, so we have measures in place for these contact and droplet precautions. Those with many respiratory illnesses require those type of precautions already, so it's not a unique situation to this. So these are all in place in our province-wide plan.
Could we handle this if it came here to Winnipeg, knowing that flu season has already kind of pushed us to the brink with a lot of our hospitals?
Yeah, well, we've already been planning for this, so we are prepared for a suspected case and have contingencies in place to deal with it.
This has been linked in the same family of SARS. Can you tell us just how closely it mimics that, or what kind of concerns there are there?
Right, so coronavirus is a large family of viruses and can cause symptoms ranging from just the common cold to some severe issues like SARS and MERS-CoV. This is a beta coronavirus in the same classes as SARS, but it's early to characterize the nature of this one. Things like the case fatality rate and how easily it's spread person to person is not really yet known.
What were the big lessons learned from when SARS came through in the early 2000s to now? How have things changed in terms of how we respond and how we handle these cases? We outlined how we handle it now, but how different is it from then to now?
Well, the big lessons learned was that the importance of identifying a potential case very early on and in taking appropriate isolation and infection prevention and control measures as soon as possible to prevent that secondary spreading. So with a travel, we need to be aware of these cases. The big goal is to reduce and eliminate any secondary spread of this virus should a case be detected.
Would folks be quarantined after there was a confirmed case, or like you were mentioning quarantining a few moments ago, under what circumstances would somebody be quarantined?
So when we talk about isolation, we're speaking about a individual with symptoms. So we would isolate a symptomatic person to ensure infection prevention and control is met.
Symptoms and who have been abroad to
meet our case definition, right. Correct. Quarantine typically refers to people without symptoms. So we do have a process in place on how we would follow up close contacts if a case is suspected on there. So we have that process in place.
What kind of information has been shared with emergency personnel who could possibly be the first ones that might come into contact with somebody?
Right, so this is part of the province-wide preparedness. So with calls coming into either Health Links or EMS, they're well aware to be screening for this travel history and these symptoms. And should that be a concern, then they will don the appropriate IP&C protection.
How is the province working with the National Microbiology Lab for testing?
Right, so the province works with the Public Health Agency of Canada, which the National Micro Lab is with. We sit with the Council of Chief Medical Officers of Health, and so and then we work with the Provincial Public Health Lab here, Chatham Provincial Lab. So we're working closely with all our partners.
And so how does that testing work? Because you and I spoke last week talking about the lab confirmed flu-related deaths, and that's already backed up. So is there a separate channel for this? How's it going?
Right, so there's, when we're talking about when issue about the flu, we were talking about surveillance on there. So there is no backup for clinical care. So somebody who's tested for the flu, as soon as that's related, the clinical care providers know about it. So the same thing with this. When the test is back, it doesn't affect clinical care. We'll know as soon as possible with this, because this requires also a immediate phone call to public health. Then we'll be immediately aware of this.
So how concerned are you of a bottleneck effect, if any?
Not with testing, no.
This.
That's right. So what we're dealing with here is we have a person under investigation. We have clear guidance on who those would be, acute respiratory illness, plus that travel within the last 14 days to Wuhan, China, or contact with someone investigated in that outbreak. Those people are going to be suspected, and immediately the infection prevention and control guidelines will put in place. Subsequent testing will guide our next steps.
And I just want to clarify, so do all possible patients or testing, do they all happen at the NML, like you said them there, or do you have specific labs here in Manitoba that will be
The test will be collected through the usual measures, but it will be sent to the NML for the testing for this specific pathogen.
So the province handles it, sends it off.
Correct.
How quickly does a virus like this spread? Because I know when people hear, in the family of SARS, it immediately sparks fear. And so can you maybe try to ease some of that fear for people?
Well, so we know that there's been evidence of person-to-person transmission. We're not sure on how efficient that is right now. There has been reports of healthcare providers in China that have acquired it. We know of person-to-person transmission, but it's too early. We don't have enough information to say, is that efficient enough to sustain transmission of this virus?
So when we talk about there being a low risk here in Canada and in Manitoba, why can we say that?
Because the nature of the spread of it so far. So we have no direct flights from Wuhan, China to Canada. Only indirect flights from that, and based on what we see here, we're not seeing necessarily the efficient person-to-person transmission throughout.
But you still have to
Especially-
be vigilant, no, because we don't know what the incubation period is, right?
We still need to identify certain things like that. We were talking about a 14-day incubation period. That's where that comes from. That's a conservative estimation based on coronaviruses, but we are taking those precautions. So that's why we have these infection prevention control measures in place right now to ensure that we're taking full precautions so we don't see secondary cases should we see one suspected
What
case.
about
They're
people who are
concerned
planning
because
to
it
travel
makes-
to China? What advice
Oh.
would you give them?
For that, those type of issues are emerging daily, the travel advice. So for a specific traveler wanting to travel there, I would direct them to the Health Canada website on travel advisories. It would be their best source.
Are there any estimates on the number of people from this region that travel to and from China? I know not directly, but there is a Chinese community here. There are other people who travel there for work and business and all those other things. Is there any estimates on the number of people that travel from here to there, especially over the last few months and coming into Chinese Christmas and all that?
Right, so I don't have clear numbers on that. We know that there are no direct flights from Wuhan to Canada, and so we're relying on indirect flights there, but we don't have specific numbers based on that.
Is there
How
any
often would
concern
you check
because it
for?
has some of the very similar symptoms to the flu?
Sorry?
Is there any concern because there are some very similar symptoms to the regular flu?
Right, so we have to be aware of that, and so we it's imperative that should we see a suspected case that we take all precautions with it. So you're going to see worldwide that many more people will be tested for this than we actually find cases, and that's a good thing because we don't want to miss a case. It's imperative that that history of travel or contact is taken because, like you say, there's many respiratory pathogens that present this way.
How often
Considering
are you
the
checking
flu-
in with the public health agency? Is it every day?
Daily we receive situation updates from PHAC.
A lot of Manitobans were pretty influential in looking at Ebola, and I don't want to compare this to Ebola, but it was an infectious disease. Do you know if there are any Manitobans who are working on finding a treatment or a cure? Because we don't know a lot about this illness right now.
Right, so I don't know specifically on Manitobans. We can direct that question, say, to National Medical Microbiology Lab. Probably have a better answer for that.
Who are all the health providers that must inform you of travelers with these symptoms?
Right, so it's reportable under the Public Health Act. So any healthcare provider who
Does it include pharmacists, for instance? What types of people, practitioners does it include?
Yeah, so it would be mostly the healthcare, direct healthcare providers, physicians there. So the information went out widespread to pharmacists as well. So
Who's required, though? The types of people who are required to report to you?
right, so that would be regulated health professionals under the Act. So it would be physicians and nurses are required under the Act to directly report to public health.
Okay, just those two. Okay.
Considering the flu season that we've gone through and the spikes in respiratory illnesses already, if it did get out here, would our population be more susceptible to something like this new virus, or is it something completely different? Oftentimes it's the lower or immune compromised people who are more susceptible to this. Is that much of a concern at this point?
So no. So currently, the risk to Manitobans remains low, and so we're being really vigilant to ensure we identify a case as soon as possible should one present. Certainly, with almost all respiratory pathogens, the higher risk groups are those at the extreme of ages or with underlying medical problems. That's certainly not unique to this virus. So overall, the risk to Manitobans at this point we would say is low, but we are prepared for any suspected cases and dealing with them appropriately.
There was a report this morning that they believe that the coronavirus originated with Chinese kate snakes and Chinese cobras. Is that a concern for anybody? Any collectors of exotic pets that might have those types of
Yeah,
snakes or anything like that?
yeah, it's too early to make anything of that. It's suspected that some animals or would be a source in that fish market, but we don't have a clear answer to what was the source of the virus.
Is it inevitable that the virus comes here, or is this is all precaution?
Yeah, I couldn't say inevitable. Certainly, we're going to see more cases of this worldwide. When you were doing case finding and everyone's actively searching for this and testing a lot of people, we're no doubt going to see that. We don't have a great understanding on the spectrum of illness this virus causes. So if this virus causes very mild or even subclinical infection all the way up to that severe infection, we may be finding a number of cases, but it'll be hard to mention right now on what the severity of those cases will be.
How important is it for you to speak with your counterparts across the country as this continues?
Yeah, it's vital that we continue to engage with all the stakeholders. So the Public Health Agency Canada, we have a Council of Chief Medical Officers of Health that we meet with regularly. We're meeting today on this matter. So just getting updates from the regions, from the public health measures that they're taking, and so we have a coordinated response.
Just checking if is there anyone on the phone that has a call or a question for Dr. Roussin?
Yeah, this is Drew May from the Preparedness. Sorry, I've just got a really quick question here. Doctor, you were speaking a little bit about the provincial preparedness plan. Does that plan have any differences between the response in rural area versus a more built-up area like Winnipeg?
Yeah, so the plan right now focuses on identifying that a suspect case and ensuring that we have them in a position to not expose further clients, and so that's not going to be unique to any region. How that might be implemented, or where we'd be directing each person in a region, that's going to be at the regional level. But all the regions are engaged and working on that. So overall, the plan is a province-wide preparedness plan.
Are there any other on the call that have questions?
This is Kelly Malone with the Canadian Press. Just a quick question that I believe you spoke to, but I couldn't hear on the phone call. We've mentioned about getting updated information. Obviously, this is a fluid situation, and you're just learning about human-to-human contact. How often are you getting information? Is it from public health? And you get to kind of describe the updates.
Right. So we receive updates at least daily from the Public Health Agency of Canada, and any subsequent updates as needed. I meet regularly with my counterparts, the other Chief Medical Officers of Health throughout Canada. We look for updates through other agencies such as the World Health Organization, as well as CDC Atlanta in the US. So we frequently are receiving and also searching for updates.
There are no more questions either from the call or from the floor, then I think we'll conclude the conference for today. Thanks again for coming this afternoon. Thanks for being flexible with the change in course. And again, thanks again for coming this afternoon.
Thanks.